Significant advancements have been made in breast cancer research and treatment over the past 30 years. Some now think of breast cancer as curable. There is no cure for metastatic breast cancer. It's estimated that 150,000 to 250,000 Americans are living with the disease today. But despite its prevalence, misperceptions abound. Addressing some of them today, Shirley Mertz, president of the Metastatic Breast Cancer Network, and Dr. Freda Lewis-Hall, chief medical officer, Pfizer. Good morning.
Good morning.
What is metastatic breast cancer, and why do you think the public should be aware of it?
Well, first of all, let's start by saying what metastatic breast cancer is. It's when breast cancer has left the breast and has spread to other parts of the body. About 1 in 3 women who have been diagnosed and treated for early stage breast cancer will go on to develop metastatic disease. And sometimes that's just a short time later, and sometimes it's many years later.
In your experience, what are some of the common misperceptions about the disease, and then what are the facts?
One of the misconceptions of the public that was found in the survey that Pfizer did is that 72% of the public believe that metastatic disease, if found early, is curable. And that is just not so. Although there are treatments that patients take, normally the median survival rate is only 2 to 3 years for a metastatic patient. And so we really need more information to draw attention to the fact that metastatic disease is very different than early stage disease.
And Shirley raises a really important point about metastatic disease and the misconceptions. We also found in the survey that about 60% of people who were surveyed knew little or nothing about metastatic disease. And one of the important misconceptions, and about half of the people in the survey had this, was that they believed that somehow this was the fault of the person who had metastatic disease. So they hadn't gotten their diagnosis early, or they hadn't followed their treatment or gotten the right treatment. And it's really important that people know that that is not so. Because women with metastatic breast disease should not blame themselves, and other people should not blame them.
What needs to be done to better support patients living with the disease?
Well, I think one of the keys for patients is we want to live longer. We want to see our children grow up. We want to live into the retirement. So we urge the public to be aware that there needs to be more targeted, focused research on metastatic disease to make it into a truly chronic disease until a cure can be found.
And what's important for women with metastatic disease and their families and supporters is that this disease does not have a cure, which means they're always in treatment. So becoming really engaged as a part of the treatment team is critical. Knowing their prognosis, making sure that they understand new treatments that are available, either through their physician or through a clinical trial. This can be very empowering and can also help women live the fullest lives they can.
Is there a website where you direct our viewers if they'd like to learn more about metastatic breast cancer or treatments or this survey you've shared?
Sure. There's a great place to start. It is gethealthystayhealthy.com. There's information on metastatic breast cancer, on the survey we just mentioned, and there are links to other information and resources I'll let Shirley tell you about.
Yes, I lead an organization called the Metastatic Breast Cancer Network, and we have on our website lots of information and patient stories, good ideas about interacting with your caregivers and health provider at mbcn.org.
Thank you both for joining us today. We appreciate your time.
Oh, thank you.
Thank you.
Thank you. If you're away from your TV and don't want to miss the Morning Blend, remember you can watch live from your phone, your tablet, or your computer. Look for the function along the right side of our homepage at omahamorningblend.com. Still ahead, country singer Ray Scott and his sophomore single release. Next, how to rock color or show your subtle side with Ming Wang.